Okay, so welcome everyone. I'm Dr. Samantha Ramanan, and this is Creating a Healthy and Strong You webinar. We're trying to do these webinars at least once a month to kind of go over the things that are most important to you as the patient, that really we're just looking for a lot of clarity when it comes to what truly is the meaning of health. What is the true definition of being healthy, being strong, and what does that look like? Because we often have this misinterpretation of what it should look like, and what it should be in reality. So a lot of this webinar is going to be kind of things we already know, right? The things that we've heard about in pieces maybe throughout our health journey, but I'm just going to try and kind of put some of the main things together so that it's clear when thinking about going after your optimal self. What things do we need to always consider? Because it's not just a one size fits all, as unfortunately our medical system kind of puts people into different lanes. So I'm going to try and clear that up for you guys today. Please let me know if you have any questions or comments. I do have a limited time on my webinar, so apologies if I go a little fast. You can just kind of say, "Oh, can you say that again?" in the comments, and I'll try to respond. But let's go ahead and get started. Let me see. I just clicked. Okay, so whenever talking about the optimal health that we should be in, we always need to start with why. And this is not just isolated to our health alone. This is in many aspects of our life. We have to start with why. So if you're like most people, you have more than just weight loss in mind. You're kind of thinking about your overall health, what I could have done in the past that I can't do anymore. Maybe you're not looking in the mirror anymore. You're kind of avoiding that because it's not necessarily your optimal self or where you want to be. And perhaps you maybe don't even have that energy to lift up your grandbabies or your children or keep up with them. Like, you have to really answer this question for yourself, but it is so very important in just the first step of your health journey. Why do you want to be healthier? Why do you want to have more energy? What is the driving force behind losing some weight or getting better sleep or being more active? This is the vital part that we all need to answer when thinking about our optimal health. And for me personally, my why has always been that I'm a physician that is talking about health all the time. I'm talking about optimizing your health and your well-being. So I need to practice what I preach. That is a very strong why for me, that I need to maybe not look a certain way, but I need to do the things that I'm suggesting. And if I didn't have that why, it would definitely be something more along the lines of, I would like to age gracefully, as opposed to maybe some family members that are really suffering, really not enjoying life anymore because they have many health problems. So you really need to dig into this root of, why do you want to be healthier? And then you can go along the lines of, how can I be healthier? And what do I need to do to be healthier? So moving right along. So it's definitely more than just fitting into that S, that small size versus the medium, or that medium instead of the large, or maybe fitting into the large over the XXL. But once you really find that why for living a healthier life, now it's time to internalize it. Now it's time to write it down, pray, meditate on it, in a daily manner, so that you can feel that motivation on those days that you're just like, I don't even know why I'm doing this. Your why will keep you moving forward. So asking yourself, how can my life be different? How can this year, this decade be different if I lost that weight or if I felt more energy to accomplish those goals I want to set out for myself? How much money would I save on doctor's visits? I mean, how much more time would I have for my family? How much more balanced emotionally I would be? Um, One of the very huge benefit to creating that healthier body to live in is that you're really going to reduce your risk factors for really significant diseases that are very common, unfortunately, in American standard diets and lifestyles. So, and one of them being metabolic syndrome, which is something you've probably heard about. I'll move this for a second over here. There we go. So metabolic syndrome. There it is. Oh, I don't know the best place to put this box. There it is. Okay, metabolic syndrome. So what exactly is it? Something very, very common in this country. And I could go into many different diseases, not just this one, but this kind of summarizes a lot. Metabolic syndrome, it's not a disease, it's a collection of risk factors, right? There's 5 risk factors, and you only really need 3 to be diagnosed with this metabolic syndrome. So the 5 include high blood pressure, high triglycerides, low HDL cholesterol, high fasting blood glucose, and abdominal obesity. Now, you might have one, you might have all 5 of these, but you definitely know someone who qualifies for this diagnosis of metabolic syndrome. It's a very common collection of issues that lead to hundreds of different diseases, put you at risk for hundreds of different things. And any one of these things that I mentioned, high cholesterol or high triglycerides, low HDL, high blood sugar, blood pressure, obesity, one of those things puts you at risk for a lower immune system and at a higher risk of, and if you encounter a virus or bacteria, you're going to get sick. This is why COVID at a incredibly low mortality rate really wreaked havoc on Americans, because this is a very common problem that Americans have, is metabolic syndrome. I think it's somewhere around 40% of Americans have metabolic syndrome. You know, just look around you. We're getting bigger and unhealthier. So at a suppressed immune system, we were very susceptible to COVID. And I'm sure you know one or many people that have this prolonged case of fatigue from COVID. So that goes into a poor recovery, a poor immune system as well. So this is what we're kind of talking about when we're discussing what's at risk. So some of the consequences, just to put that into perspective for you. Some of the complications of untreated metabolic syndrome is that it usually builds up to something more serious over time. Maybe high blood sugar doesn't really bother you now, but it will put you at higher risk for a heart attack and stroke, as opposed to people with no metabolic syndrome. So it puts you at risk for twice as likely to develop either a heart attack or a stroke. If you are not diabetic, but just have that borderline slightly elevated blood sugar, or let's say you have high blood pressure and high triglycerides, you are 5 times as likely to then develop diabetes. These things just kind of collectively compound upon each other. And I'm sure you know some of the risk of diabetes, but I will list them. If you have diabetes, you're at a higher risk for nerve damage, something called neuropathy, kidney issues, inability to heal well, eye damage, things like this could definitely develop. And then a couple of other things, if you have metabolic syndrome, you're definitely higher risk for hardening of your arteries and non-alcoholic liver disease. And of course, we already kind of talked about the immune system. So there's a lot of consequences of metabolic syndrome, and it kind of covers a vast category of people, and that's why I kind of bring it up. So obesity. When I'm talking about obesity, I'm talking about more of the abdominal obesity. It's more obvious to see in people. It's really the fat around your organs, kind of the weight we carry in the front. It's usually a cue that there might be one or a couple of those risk factors of metabolic syndrome going on. And in fact, if you just have a little bit more adipose tissue than you normally would, that itself puts you at risk for insulin resistance. So more risk for developing the actual diagnosis of metabolic syndrome or diabetes. And of course, excessive inflammation, excessive weight on your body leads to more stagnation of blood, more issues in your joints because your joints bear more of that weight, more of that load, and ultimately further weakens your immune system and your ability to fight off infections. So that's why it's important. One of the many reasons. So I bring this up because what are your excuses right now? And we all really have them, even if we think that we're living a fairly healthy lifestyle. Everyone has an excuse for not living ideally an ideal healthy lifestyle. So what does that look like for you? Could it be, well, I just don't have time. My job is it's just too much. I barely have time to recover. I really can't afford it. I can't afford to buy healthy fruits and vegetables or a healthy meal plan. I don't know how to be healthy. That's a common one too. But there also aren't real barriers that are standing in your way. In reality, these excuses really are based around the habits that you make for yourself, that you're really afraid to break and kind of get out of your comfort zone. We all have these major habits and minor habits that we're comfortable with. Whether when you're coming home from work, you sit down on the couch and watch your favorite show, and that's how you unwind. We all have these small things that we need to really break, and really identifying those true barriers it's hard. It's hard to bring to light because they're often not as superficial as they look. They're often pretty deep rooted. These feelings of self-worth, lack of self-love, or just poor mental stamina, poor mental health. I mean, they can all stop you from moving forward, moving towards your health goals. So it's definitely important to address that mental emotional aspect of why you can't get motivated, why I can't stick to the plan. I have the plan. Why can't I do this? At the beginning of your health journey, but you can also do it as you move along in your health journey. Just remember, you and only you are responsible for making sure you make decisions that move your health into a positive direction or a negative direction, or you just stay where you're at. It really only falls upon you. So keep that in mind. You are responsible for your health. Okay, so creating some time for movement. Yeah, definitely the time is a barrier. Creating time for healthy habits, it's going to always be a challenge, always a challenge, because if you're like most people, it's usually balancing work, family, spouse, kids. Your self improvement usually comes at the end of that and is usually eliminated. That old saying that exercise is probably the first thing to go in terms of what you do for you. It's because we tend to prioritize what we're doing at work, our family life. Um, but I'm not going to lie, ignoring your own self improvement, your own health is hurting you more in the long run. And if you make small changes, they are going to project your life into a realm later down the road that you couldn't even imagine. And it is important to create that time with your already full schedule and just stick with one thing at a time. Small baby steps. It always starts with one step, right? And it starts small. It definitely does. Something like creating a grocery list, being intentional about what you're purchasing for food, maybe going out to eat, trying to reduce that less. Maybe doing some small workouts or walking with a dog, doubling that up. It always starts small and you can build upon that. But the first step is key. Okay. So of course, we got to make some positive lifestyle choices. And sometimes this can be confusing, but the most important thing with making positive lifestyle choices, in my opinion, is knowing yourself, which sometimes can be difficult in itself. I have found that most people don't know their own motivations a lot of the time. Don't know their own triggers, what kind of situations they thrive in versus you kind of stumble in. So the first step is knowing yourself. So, and if you don't really have a good grasp of that, then maybe asking the question, where or who or what am I doing? What are those circumstances in my life that puts me in a position of choosing poorly in terms of my health? So, not going to the gym, not reaching for a healthier option in terms of food. What are those circumstances? And then change those circumstances. So, take a moment maybe to think about what's in your pantry right now. Do you have a healthy option? Why not? Did you consider a healthier option? Do you have a lot of processed foods in your pantry? With most things concerning health, the first thing it comes down to is your diet. The things that we're putting into our mouths creates a majority of our actual physical mental health. So opening up that pantry and taking a look inside will be illuminating. And then let's say exercise. When it comes to movement, do you seek some opportunities to move your body more, or do you completely avoid them? Do you, at all costs, do you you send someone else to do it, or do you drive as opposed to walk? What does that look like? So every day we're faced with these kind of small decisions that really can contribute and compound upon each other in terms of a better, healthier life for ourselves. So if you pay attention to those things and change the choices that you're making, even if they're very small, over time you will see a dramatic shift in your health. Okay, facing up to your emotional connection to food. So this is a very difficult thing to break as well, because food is very cultural. Sometimes food is the only connection that some people have to their roots, to their home country, This country is full of immigrants, so it's very it's very emotional and tied to our memories of different types of foods, such as we bake cakes when there's something to celebrate. We always have cakes and cupcakes and those sweets. They are meant to be something you don't have every day, but something that you have in celebration. But that emotional connection of eating something sweet in a times of happiness, that can be connected to later in life when we're feeling down and depressed, that we reach for something sweet, that sweet pastry, that sweet cake, because there is that emotional connection to our food. So taking a moment to think about how the foods that you eat are connected emotionally for you. Like when you're feeling stressed, what do you eat? When you're sad, when emotions are high, what are the things that comfort you? Part of your journey involves deciding why you make these choices. And I can definitely speak from experience on this. I do not pay attention to my diet when I go home to visit my family, because it's just like, why bother? Why struggle? Why fight? And that's something that I've struggled with a lot. But now that I'm healthier, it's just not worth it. It's like 10 steps backwards when I eat in a way that I've worked so hard to break, if that makes sense. So I'm in a different point in my life that I can be a little bit more resistant to those things, but it all takes time. All takes time. So definitely one of the most important things to succeed is your support system. Making any change, any small change even, is difficult in your life. And it's even more difficult if you don't have someone to support you, whether it's a family member, your spouse, your children, a friend, you name it. And this can be someone you pay too. It is hard to make changes without support. So having that sense of accountability, something to provide you with confidence when you're feeling down, and definitely the access to knowledge, the right choices for you specifically for where you're at. And this can make all the difference in whether or not you succeed. So this is determining your ideal body weight. This is a interesting thing to think about, because the concept of ideal body weight it's imperfect, to say the least. In our society, we are bombarded with things that truly are not healthy. The big, ripped, muscly guys and action movies, that is not what health looks like. I promise you, they cannot throw a punch looking like that. I promise you. And the concept of the system of a BMI is definitely flawed because of different body types, different backgrounds. So instead of worrying about what that number, that special number for your ideal weight is, it's better for you to think about, when was the last time I felt healthy and happy? And think about what you looked like, what you weighed at that time. What did that look like? What did you do? And make that weight your goal. So whether or not your BMI chart should say you should be 135 pounds, but really you felt the best, happiest, most comfortable at maybe like 145, that's okay. Make that your goal. Don't get too hung up on a one specific number because one system says that is what your healthy body looks like. Health isn't just about that number on a scale. So keep that in mind. Okay, so getting into the foods I've already kind of talked about. Wow, my time is almost up. Did I really talk that much, guys? Okay, let me I got 10 minutes, but I will get going here. Okay, eliminating the foods that aren't serving you. Generally speaking, if it comes in a box, microwavable bowl, in a can, if it's loaded with preserves, it's not good food. It has added sugar. It has coloring. It has chemicals. You name it. It's if your ingredient list is 20 ingredients or 50, it's not good food. So I'd say that the most helpful thing to keep in mind when looking at the different foods that you should be choosing is try to stick to whole food, plant-based most of the time. So sticking to the peripherals of the grocery store is going to be your best bet in terms of picking up the things that are the healthiest for you. And that usually goes along with whole grains, whole foods. I'm sure you've heard these words before, but it really generalizes high fiber, plant-based nutrients, full of vitamins and minerals that your body needs. So think about that when choosing different foods. Okay, definitely sleep is important. You cannot prioritize your sleep enough, guys, because when you sleep, you repair your muscle, you repair your blood vessels, you repair your brain, you make new connections. You produce all of your hormones when you sleep. This cannot be discounted. It is not a badge of honor to work so hard that you don't sleep. And that concept of sleep when you're dead is 100% wrong. You need to prioritize your sleep, and you need to make sure that you get good sleep that is on average about 8 hours. Easy to say, minimizing stress, very, very hard to do. And a couple, and this looks differently for everyone. This is why it's so hard to minimize. There is no cookie cutter for minimizing your stress, but it really plays a huge role into your health and well-being. So real quick, what are some tips to minimizing our stress? So things like prioritizing what are the things that have to get done versus the things you want to get done versus the things that can wait to get done goes a long way. Saying no to family and friends will go a long way too. Stop pleasing everyone. Exercising regularly, sleeping, of course, doing what you love, breathing, laughing. You can see how all of these things are kind of tying together. So how do you minimize stress? You get good sleep. How do you get good sleep? Minimize stress. So all these things compound upon each other. Being grateful. If we are grateful for the things that we have, there is very little room for things like depression and anxiety. So finding a moment to be grateful, however that looks. Okay, staying motivated. This goes back to your why. This is why we start with why. Go back to your why. When you are feeling down, when you are feeling like your short-term goals are not matching your long-term ones, how do you stay motivated? You go back to, for me, I need to practice what I preach if I am going to recommend certain things to my patients. I need to pre-plan my routine. I need to set some mental boundaries and space for these healthy habits so that I don't have to worry about what to do next. So staying motivated, staying accountable, this definitely goes back to your support system too, will help you in the long run getting there, getting to your ultimate goals. Real quick, I just want to touch upon this. There's a fine line between being health-centric and health-obsessed or health crazy. You want to be health-centric. There is a balance to everything in life. If you have that splurge, don't beat yourself up. That's going to be more harm in the long run. So sticking to the plan 90% of the time, that's what we're striving for, because life is life. You're going to face some challenges. So we need to embrace these things. We need to embrace the challenges that come. And you need to understand that we're not going to go from 0 to 60 all at once. So what is the easiest thing for you to focus on right now, right today? And I would say, when the challenges come, the most important thing for you to do is to get right back to where you were as fast as possible. That's what you need. So let's say you plan to eat well and your complete diet went crazy because you went on vacation. The moment you get back, making that intention, prioritizing, okay, I ate horribly because I was on vacation, but I'm right back to my routine. I'm right back to exercising. I'm right back to my journal. I'm right back to whole foods, plant-based. Things happen. We fall off our habit, but the most important thing is to get back into the routine, get back into it. And then, of course, trusting the process. So our society definitely loves instant gratification. Your body doesn't know the difference. It's not going to be an overnight thing from unhealthy to healthy. It is a process, and you need to respect your body's process. You need to respect the fact that it's going to take time, because it took time for you to build this unhealthy lifestyle. So give your body time to respond. This is why crash dieting and these crash lifestyle retreats often don't work, because it's all about the long-term things that you do in your life. So understanding it's going to be delayed gratification, not instant gratification. So trust that process. And you obviously have a team here at MedLink to help you with that process if you need some motivation. But it all starts with that first step, that first why. Why do I want to change anything? So I know I went through some of those things for quite quickly, but I do have more resources and reading for you guys, because I always want you to verify. I always want you to learn more. Don't just take my word for it. Read, get access to some knowledge, empower yourself to understand your specific needs and what would be best for you in your lifestyle. So I only have less than a minute. It's probably going to cut me off, but thank you guys for spending about 40 minutes talking about this with me. I'm going to send out a link if in case you want to replay it. But I appreciate your time. Sorry, I went a little fast for you guys. I didn't have time for questions, but next time I definitely will make time for more questions, because I want to hear from you guys. What are some of the challenges? So until next time, thank you all. I'm Dr. Samantha Ramanan with MedLink Health Solutions. And if you need any more help on your next step, we're here for you. So thank you, everyone.